Previously, we discussed about what is schizophrenia and how the schizophrenia caused and which part of brain is damaged in the schizophrenia. Now we are going to see about types of schizophrenia. Myself Sukumar, I am the student of occupational therapy. These types are classified on the basis of how the symptoms are shown during the assessment period. First, paranoid schizophrenia. Second, disorganized schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and residual schizophrenia. Okay, let's discuss about paranoid schizophrenia. In this, delusion and hallucination are present. In delusion, persecutory delusion. We already discussed in our last video. Persecutory delusion means fear, other the person's having belief of someone is going to harm us. So that like belief they have. But actually no one going to be harm him. They have a false belief of someone is going to be harm me. And they have some auditory hallucination. They have delusion, persecutory delusion and auditory hallucination. But they have normal intellectual functioning, which means they have very good IQ and they may express some feelings normally. Sometimes they excessively show anger, argumentness, and anxiety. So they may interfere in other arguments also. So these symptoms are shown in paranoid schizophrenia. Next, disorganized schizophrenia. In this, they have disorganized speech and disorganized behavior. They have disorganized speech, so their speech cannot be understood by the others. So if they start speaking, we can't understand. If they start behave something, so we can't understand what are all doing. So what they going to say us. So by their behavior, we are showing something like to others. So by their behaviors, we can't get anything from them. They may laugh at irrelevant things. So they may laugh at changing the traffic light. They are doing any other work. There is another change is happening there. So they watch and start laughing. They have this problem also. In paranoid schizophrenia, I said they have some good emotions. But in this disorganized schizophrenia, they have flattened emotions or inappropriate emotions. They have difficulty to preparing meals, showering, and dressing also. Okay. Third type, catatonic schizophrenia. Catatonia means there is a problem in movement. So what are all the possible problem in coming in the movement? So they may have hypermobile or immobile. So the person may persist for immobilization or they may persist for over. So they mobile around the space, all space. This person try to copy what are all we do and what are all we say, but they repeat it unsensibly, which means senselessly. So they don't think and say. They thought what are all we do that is done by them, but they not. They do copied items improperly and senselessly. This catatonic schizophrenia putting this person at high risk because they lack their self care. So they don't care of themselves. So that affect their present and future also. Then fourth type, undifferentiated schizophrenia. These signs and symptoms cannot be explained by any other schizophrenia, paranoid or catatonic disorganized, but they may have chances to have some symptoms, delusion, hallucination, or any involuntary movements and speech problem also, but it cannot be explained by these schizophrenia, but they have two or more symptoms by these. So then they have undifferentiated schizophrenia. Finally, residual schizophrenia. The person has at least one episode of schizophrenia in past, but now they have no schizophrenia, which means they already have schizophrenia. It is completely reminisced, completely like to have no symptoms at present. That is a residual schizophrenia. Already come, but here no symptoms shown. So here symptoms shown. So this is a episode of schizophrenia. Then flatten. So which means no symptoms are shown. In this phase, it is called a residual schizophrenia. Some persons may show psychotic episodes again, but some persons don't show along the lifetime. I believe you are all get information about the types of schizophrenia. I also need motivation. Kindly subscribe. Thanks for watching. Be proud to watch my video. Thank you.